Welcome to the Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay healthy and happy. So join me as I sit down with fellow experts from Boston Children's to find answers to the questions that matter most to you and your family. Hi there, and thank you for joining us. Today we're going to talk about autism spectrum disorder. Let's start things off with our parent question.
Hi, I'm Meg. My daughter has autism. How do I explain to others that the autism spectrum is broad, or that people are not all the same and deal with different challenges?
Thank you, Meg. That's a great question, and one that we're going to answer today. Joining us to talk about autism is Dr. Sarah Spence. Dr. Spence is a pediatric neurologist and co-director of Boston Children's Autism Spectrum Center. Welcome, Dr. Spence.
Thank you for having me. This is so exciting.
And one of the questions that I like to start off every conversation with is learning from our guest expert how it is that you decided to go into the specialty that you are in. Can you tell us a little bit about how you got involved in this?
Sure. I have always been interested in the brain and behavior. And so I actually did a PhD in neuropsychology. And while I was there, I wanted to get a little bit more clinical. And so I decided to go back to med school. And when I was in medical school, I just assumed I'd do neurology because of the brain. And I fell in love with peds and thought, so I really should do pediatric neurology, but still wanted to really look at the behavior. And so things in child behavioral neurology are things like ADHD and learning disabilities and autism. And so luckily I had a colleague who needed a research assistant in a big autism research project. And I got pulled into that and went around the country doing home visits for families with kids with autism. And I got to hear all the stories and all the challenges and all the triumphs. And it was just an amazing kind of introduction to the field and to my specialty, and I've never looked back.
You know, you never know where life's going to take you based on your experiences as in your early career stages.
Absolutely.
That's really amazing. Well, welcome. Super excited to chat with you about autism today. And so I thought maybe we should start off with what is autism spectrum disorder?
Well, as Meg's question talked about, it's really a very wide spectrum. And it's one of the reasons that we went from calling it autistic disorder to autism spectrum disorder, because there are so many different ways of presenting. I think the important thing to think about is that there's two main things that define autism. One is the social communication difficulties, and the other is the kind of restricted interest and repetitive behaviors. So those are the two big things that everybody has to have. But you can imagine that every different person with autism presents with those symptoms very, very differently.
What do we know about, the biology of it? Like what causes autism? How does it fit into other clinical situations?
Yeah, that's the probably by now billion-dollar question, right? With all the research that has been going on. And I think the probably cheap answer is we still don't know completely. What we do know is that it's a neurobiological difference in the brain, the way the brain is organized, and especially I think the way to think about it is the way the brain is wired. So, and the brain is a bunch of neural connections, right? It's a bunch of wiring, and the way the brain is wired in people with autism is quite different. If you look at an MRI scan, right, a picture of the brain, you can't tell that somebody has autism, but the individual connections that are more on a microscopic level are the things that are different. Many of the genes that are associated with autism are synaptic genes, or genes that kind of mold that connection. Lots of people think that there's a very strong genetic component, even in identical twins, right, whose genes are exactly the same, 100%. there isn't, if one has autism, the other doesn't automatically have autism. Now, it's very strong. It's probably 90%.
Wow.
But that means that there's 10% where the other one doesn't. And so that kind of tells you that it's not only the genes, it's the way the genes are activated, right? The way the genes are showing up and changing the way the brain is organized.
Wow, that's incredible.
We still are not finding something in every person with autism. There are a lot of people who think that there are some environmental differences. So premature babies are at increased risk. Their brain came out and is in the environment too early. Different brain injuries are associated with autism. Kind of poor pregnancy outcomes in general have been associated with autism. So there are lots of different things and probably not one single cause.
Yeah. So it feels like so many things, right? There are definitely genetics that can explain a part, or maybe in some cases all of it. But then we also know that if there's some type of an injury early on during brain development, then that could also cause autism.
Yes. There's one part of the brain that's been very well studied and people are very interested in, which is called the cerebellum, the back of the brain. Kids with early cerebellar injuries sometimes have an increased risk of autism, but again, it's not 100% predictive. Yeah. So I think that's the important part.
So I feel like I shouldn't have to ask you today, but I think still some folks are worried about vaccines and their role in causing autism. And clearly we know that myth has been debunked, but I just wanted to hear from an expert. Is there any link?
You are absolutely right that the word myth is a really good one there, and debunking is also a good one. That myth has been debunked, and I think that's just so important for everyone to know.
Yes.
I am a very strong believer in that every child should have their childhood vaccinations, and that there really is just no link to autism, and there's really good research that suggests that that's true.
It's really important to be sure what the science shows.
Yes.
That's great. Thank you. I'm curious, Dr. Spence, for those of us that may not be as familiar with autism, what are some of the challenges that children or young adults with autism face?
When we think about the social communication challenges, it's not always that people don't speak, although there are some people with autism who really have no speech or have kind of minimal speech. But it's even those who are speaking, it's the way they use their speech to be involved in a conversation and a back and forth. So one of the things we think about is social reciprocity, right? That back and forth, that social connection that you have with another person. And that is a challenge for a lot of people with autism. Even things as simple as not answering when somebody calls you. Yes. Right? So if you aren't connected socially and your parent calls your name, you don't think that it's particularly important to respond. And so there are some families that say, I thought my kid had a hearing loss, right? Because they weren't ever answering so that's one of the kind of early signs, is that they're not answering to their name. Maybe early signs like playing baby games, playing peekaboo, might not be as interesting to a kid with autism. They might be super happy to play, but they're playing on their own. And they're not sharing that with another person and getting involved in that kind of to and fro reciprocity. So that's one piece of the social communication.
That's the social. Yep.
Another piece is nonverbal communication. So things like, you always hear about eye contact with people with autism, but that's one piece. Nonverbal communication involves your tone of voice, it involves your facial expressions, it involves your gestures. And so they are missing these social cues, right?
Wow.
And then finally, if you think about those two things, that reciprocity and the nonverbal communication, those are super important for developing relationships. So the last thing is really that development of relationships. And you think about it, and the thing that seems to be particularly difficult for people with autism is same age peers, right? They may be great with their parents, with their siblings, but in school, for a kid, is going to be a lot harder. And so some things that we hear is that the teacher says, "This is my favorite kid. He's in with me every day at recess. What are you talking about? How could he be autistic?" And I said, "Listen to what you just said. He's a kid and he's in with you every day at recess. That's not typical, right? That this child should be wanting to be out on the playground with other children." You might hear that a child with autism does better with younger or older kids.
Yeah.
Younger kids because they can kind of make the play around what they want to do, or older kids because the older kids can kind of put up with it a little bit better if they're a little rigid. Developing and maintaining social relationships is very, very difficult.
It's really interesting, too, how you say sort of some of the characteristics could be perceived by others, right, as, a preferred trait. And maybe it has advantages, but it's good to be aware of so that you don't miss the signs.
Right. I think the other big thing is when you start thinking about restricted interest and repetitive behaviors, that can be a lot of different things. The kind of most basic is repetitive movements. We call those stereotypies, the body rocking back and forth, or the hands flapping a lot, or some kids bang their head against things. Those are all considered kind of stereotypies. There can also be noises that are made, or even things that are said over and over and over again. Some kids with autism have something called echolalia, where they'll just echo back exactly what was just said to them, or some scripted speech where they'll take something that they learned from a video or from a book and they'll use it in their conversation. And sometimes they're using it very appropriately in context, right?
Yep.
But it's something that's a script. It's not something that's independent sort of utterance, right?
It didn't come from somewhere inside. It's sort of like just repeating that.
Exactly.
I imagine that sometimes it's probably not in context as well.
Yes. Oftentimes it's not in context.
Wow.
But I like it. I like to hear when it actually is, because that makes me think this kid knows what's going on in the social situation and is trying to communicate here,
and
right?
to apply those lessons learned. I
think the other pieces of the restricted interest repetitive behaviors are kind of the insistence on sameness. That's what we talk about. That and you could also think about that as kind of rigid behavior, of ritualistic behavior, of needing things in the same way all the time. And that you can imagine, can really get in the way. And that's where a lot of maladaptive behavior that you really don't want to see, tantrums, meltdowns, because they're not getting what they want. And it's way more than a typically developing child. I mean, every child wants what they want when they want it.
Yeah.
This is, amplify that by 100. And that's what you tend to see with autism. And then some kids have really, really intense interests, and they can be either pretty typical interests, but way more than you would expect them to. So the kid who likes dinosaurs but knows every single detail about those dinosaurs.
Wow.
Or it could be a quite unique interest. So I have a patient who knows the Paris metro map. He's not actually been to Paris, but he can tell you every stop. He can tell you how to get from one place in Paris to another place in Paris because he knows the entire Paris metro map. There are kids who are interested in weather. There are kids who are interested in elevators, right? And there are just some really interesting, unique intense interests, which sometimes get you to a point of going into a career in that area, which is kind of fun.
Yeah, amazing.
And then finally, we see a lot of sensory differences.
Okay.
So sensory, you can think of either kind of being too sensitive to something or being insensitive to something. So For the touch sense, you can be too sensitive and you can't stand certain things touching you. You can't stand sand or wet grass or the way jeans feel on your body, and so you can't wear those. Or you'll hear about parents cutting tags out of the back of the clothes, although I think that bothers everybody because, everything's tagless now. It's printed on the back.
That's where, things that work for everybody when we think about inclusivity.
Exactly.
Benefits.
But there are unusual visual inspection of things, getting up too close to things or peering out of the corners of their eyes. There are some kids with autism who smell things that you wouldn't expect, pick up and smell a toy. And many kids with autism have a lot of sensitivity to loud noises, but particular noises. So the vacuum, the blender, you'll hear about parents who say, I have to actually move the child out of the room when I'm going to do those things. Or I have a few parents who can't use public restrooms because they're so loud. The hand dryers or the flushing of the toilet is so loud that they can't use public restrooms. And that really gets in the way for the family, right? Because they can't take their kid out into the community.
So clearly a lot of symptoms to consider when we're thinking about whether or not a person may have autism. I'm hearing more and more that there are more people being diagnosed with autism. So can you help us understand really how common is it?
Right now, it's 1 in 36 children have a diagnosis of autism, which is really much more common than it used to be. Yes.
And that's what I think most of us hear, right? It seems like the numbers of kids who, and even adults who have been identified as having autism, the numbers are growing. So do you have any insights as to why that might be?
There's more services now. So in the past, if there were no services, why would you bother to get a diagnosis if it wasn't going to help you? And now it really helps you. It helps you get supports. It helps you get through school. So I'd say better recognition, earlier recognition. But I think there are some epidemiologists who think that it's just is out there more. And that may play into the genetics, right? If there's genes that contribute small pieces to the behavioral spectrum, they're more out there now.
Are there differences in terms of gender or other unique characteristics?
Yeah, that's one of the very long-standing differences. We think that it's somewhere between 4 and 5 to 1, males to females. So it's much more common in males. I think probably we have missed a little bit in girls. Girls present quite differently with autism, and I think maybe this is my bias, but I think that girls have a little bit more social skill. And so maybe they've kind of been able to skate under the radar. But I think that for sure, long-standing, there has been more males than females. And that's something that we, from a understanding the cause of autism, still don't know.
So much more to learn there, I think, as we try and uncover why that is. I think the diagnosis piece really resonates with me because I think about when I was an early career pediatrician, we didn't have any of the screening tools. Like that was, now I'm a neonatologist, so that's not really in my specialty, but as a general pediatrician, no one knew of that. That didn't exist. And now it's part of routine, care for kids at a young age to do those screenings.
It is. The American Academy of Pediatrics really requests that you do screening at 18 and 24 months in order to try to catch these kids early. I think there are some times when even at 18 and 24 months, you don't necessarily see the signs. And so even later, we have a lot of kids who are coming. We're trying to focus on the littlest ones, but we have parents coming and saying if their children are autistic at 10, 12, 16.
Yeah. That makes sense now, especially as the awareness has increased and as we have better tools to help diagnose. So thinking about that, knowing that there's now screening and more tools for diagnosis, how is autism spectrum disorder typically diagnosed?
So it is a clinical diagnosis, which is really important. It is not one of those things that you can do with a medical test, right? So there's no brain scan, there's no blood test. But I would say the most important thing is learning a lot about the child's development. So even if the person in your office is 14, you're still going to go back and ask the parents what they were like when they were younger, because it is this developmental diagnosis. Yeah. And then you also want to ask, what symptoms is the child having now? But there are diagnostic criteria that are listed out that really talk about those pieces we already talked about of the challenges that they face in social communication and the restricted interest and repetitive behavior. We often will ask teachers, therapists, coaches, other people who work with the children. For the little kids, early intervention is a great person to ask. If the child has some language delay, they probably had early intervention there. And the early intervention specialists know a lot about the difference between plain language delay and a true social communication deficit that we would see in autism. So we try to get information from other people. The insurance companies now are requiring standardized testing. Psychologists, neuropsychologists, developmental pediatricians can make the diagnosis, child neurologists, child psychiatrists, developmental specialists in general. Because people are waiting a long time for the diagnostic evaluations, we're working on training general pediatricians to do it.
If you're a parent and you suspect that maybe your child has a few of those signs and symptoms we talked about, what's the first step that a parent should take?
Definitely discussing it with the pediatrician. Every pediatric specialist knows to listen to families, right? Knows that the parent is the expert. And so if the parent is concerned, then absolutely that pediatrician's probably going to make a referral to a specialist that will make the diagnosis.
Yeah, and I can imagine for parents to be, just sort of aware and knowledgeable, it's important for them to not be afraid to talk to your pediatrician, because they can help you narrow that down. Like, is this something that really needs to be evaluated or not?
Absolutely.
Because there's a lot of misinformation, too, I think, out there.
I think there is. I think we're doing better now in the media. There are TV shows that actually try to accurately represent people on the autism spectrum, and I think that's very, very important. There are even reality TV shows.
Sometimes media has a great way of just helping to improve inclusivity and awareness. So I love that.
Absolutely.
So knowing that we are diagnosing so many individuals at even, adolescence and young adulthood, why do we think that is, that we're diagnosing so many individuals with autism at a later age?
I think the awareness of what autism is and the neurodiversity and neurodivergence, I think there are a lot of adults who start to think, maybe this is why I had some trouble when I was younger.
Yeah.
I think the other thing that I have seen and certainly have heard about is the parents whose kids are getting diagnosed start to think back and think, this kind of makes sense for me. And so as an adult, now as their children are getting diagnosed, because we do know that it's more common if in families, because of the genetics piece, that the parent is going to look for a diagnosis at the same time when their children are diagnosed.
Yeah, knowledge is powerful.
Absolutely.
And as you're learning about the signs and symptoms for your own child, it makes sense that you might recognize how they might be in you as well. That's really fascinating. Of course, just like any other situation, complication that an individual has, treatment is key. So what are the treatment options for an individual with autism?
Absolutely. So the most important one is kind of early intensive behavioral intervention. The symptoms are often behavioral, And so the behavioral intervention is key. And there are many different behavioral interventions. So one that you'll hear about is applied behavioral analysis, or ABA. That's probably the one that has been best studied and so has the most evidence base. And here in Massachusetts, it's the one that is most readily available. There are others that have been studied also. There's one called the Early Start Denver model. There's one called pivotal response training. There's a bunch of these kind of early behavioral intervention methods that are meant to really break down tasks and give kids the ability to learn tasks better, because typical teaching doesn't always work.
Oh, yeah.
And importantly, typical parenting doesn't always work. Some parents feel like I'm not doing a good job, and that's not true at all. It's that the parenting that would work on a brain that's typically developing doesn't tend to work on a brain that has autism. So having a professional teach you what to do is super, super important.
I feel like as a parent that resonates so deep because, you if there is a different, we all grew up, right? Sort of being parented by our parents and sort of following that structure. But if a child has an atypical brain and how they think and react and interact, then we have to have new strategies. And that can probably be so powerful and empowering for the parents as much as it is important for the child.
Absolutely.
That's really important. So having said that, knowing that these behavioral strategies are so key for treatment, where does a parent go to get that, that training?
It really depends on kind of the age. For the little kids who you really suspect early, 18 months, 24 months, early intervention can get that for you once the diagnosis is made. When you're a little bit older, schools do kind of ABA-based classrooms. So there are agencies in the community where when you're out of school, you can get some extra therapy. So those ABA communities, in the old days, they were all in-home, and now some of them are center-based. So you bring your kid to the place and they get their therapy there.
Wow, that's great. I've also read a little bit that sometimes for kids, there are both individual therapy and then there's even group therapy. Is that something that has been found to be helpful?
Absolutely. So group therapy, we think about more in terms of developing social skills, right? So you might want to learn the keys to social communication and learn the keys to being a little bit more flexible, which could be an individual therapy. But then you have to interact with somebody else to practice. These groups are a way of the kids being around the peers and figuring out, how do I make that introduction? How do I listen to that other person who might be talking about something that's not as interesting to me, but that's what social interaction requires. And so I think those social skills groups are really, really important.
And then from a treatment perspective, just so that we're all aware, there's not like a medicine or a procedure that helps for kids with autism.
Unfortunately, no. We use medicines to treat some symptoms. So there are kids with autism that also have some other disorders. They might have anxiety, and we use anti-anxiety medications, as well as anti-anxiety therapy. We have kids who have ADHD, and we use the ADHD medicines to treat the ADHD symptoms. I often will tell parents that treating the ADHD might actually allow their kids to be more present in their autism therapy, right? If they can't sit still, if they can't listen, if they can't, it's kind of hard to get them involved in this very intensive behavioral therapy. So sometimes that's really important. But right now, we do not have a medicine that actually treats the core symptoms in autism. People are doing a lot of research in this area.
Interesting.
You may have heard about people talking about oxytocin and vasopressin. Those are the social peptides. They're not clinically available yet, but lots of research is going on. Some of these single gene disorders now have medicines that are actually meant to change the mechanism in the brain. If the gene made the synapse not quite work right, the function, we might have a medicine that changes the function. Again, that's for a small percentage of kids with autism, but that's a really promising area.
It's so exciting to think about, where we're going as we're learning more, as we're understanding autism, and then thinking about all of the different, therapies that we can develop over time.
Absolutely.
It's great. So for parents, going through these therapies, how can they get involved? What is their involvement?
That's a great question and really important. Parents need to be involved, right? Even these therapies that could be 10 hours a week or even 20 hours a week. 20 hours a week is nothing compared to how much time you're spending with your family, right?
Yes.
So having parents involved in the therapies is incredibly important, and they should be involved in making the goals. Right? Oh. You can teach lots of different things.
Yeah.
What matters to you? If your child is super rigid and you can't get them out the door because they need what they need when they need it, that's going to be your goal. But the ABA therapist isn't going to know that. You know that. So as a parent, you're going to be involved in setting the goals and prioritizing what you want the therapy to work on. And then carrying it over. One of the things about ABA is using positive reinforcement. Consequences don't work so well with kids on the spectrum. And so using positive reinforcement, that has to be all the time. That can't just be when the ABA therapist is there.
Yes.
So you can create behavior plans, you can create visual schedules, you can use timers, and if the child can do what they need to do to get through the day, they get rewards from that.
That's great. Yeah, so obviously parents are pivotal. They're leading this whole therapy journey, really. And
Absolutely.
And then it's important to be able to carry that on throughout the child's whole day. That
Absolutely.
makes all the sense. Like anything else in parenting, right? It's a lot of work but it pays off.
And their grandparents and their cousins and their
school teachers.
Absolutely.
Wow. Yeah, it affects the whole community. That again, raising kids takes a village. How about other therapies? In addition to therapy specifically for autism, are there other things that parents should be thinking about or looking into?
Absolutely. So many people, especially the kids who have a language disorder, using speech therapy is incredibly important. Some kids have a language disorder to the point where they actually need augmentative communication, so that they can use things like the picture exchange communication system, PECS, or they can use a device. An app on an iPad or a speech generating device to be able to communicate. So speech and language therapists work on that. You can use occupational therapy for a lot of the sensory issues. The occupational therapist can help kind of desensitize so that they can function better in the community. So there are these other therapies that are used for other things, but that can be kind of tailored for use in autism. I mentioned for kids with anxiety, having therapy for their anxiety, or for kids who develop some mood disorders, having therapy for that. So all of those things can be helpful in autism as well.
Obviously, if a child has those other things, just like a child who may not have autism, you're going to want to get those therapies. And so it's a combination of how you integrate those. That's really important. And I think it's important for those parents that have a child with autism, to be aware that it's not just that one piece. We need to look at all of those different aspects.
Yes.
That's great. Comprehensive whole care. So, Dr. Spence, I just think you're so knowledgeable about caring for this patient population. And I think about like sort of myself, my family, we have a disability, right? And that access, inclusivity, just for folks to understand what's different for us and to not feel like there's barriers out there. How can we make the world more inclusive for kids and adults with autism?
Great question, and something we're thinking about all the time. So one thing I think is accommodations, right? So for somebody with a physical disability, we think about those accommodations all the time. We think about ramps for wheelchairs. We think about lifts in hospital areas. We don't think about that for people with autism.
No.
So I think there is a lot of work going on now to provide more accommodations, certainly at Boston Children's in the medical setting. We have patient support plans, we call them, to accommodate a child who might have a really hard time with medical visits, maybe waiting in a quieter room. If you can imagine tactile sensitivity, a blood pressure cuff, not a great thing, right?
Yeah, no.
So could we wait and do the blood pressure later? So we have to think about the individual child. And then we have to think about how the child communicates. And some kids do terribly with lots of words. And so stopping talking might be the actual best thing to do. I think having more knowledge about autism helps in the community for sure. And just having more knowledge about neurodiversity in general.
Yes.
And how everybody kind of behaves and thinks and acts and needs different things being out in the community, and being understanding of those differences, I think is crucial.
Yeah. And being welcoming and helping individuals to feel like they belong is really, I think, the ultimate goal for anyone with any diversity or disability. And obviously for neurodiversity, it may not always be apparent, like a physical disability, but nonetheless has just as much need for making sure that we're inclusive. That's great.
Very important.
So Dr. Spence, I've learned a lot. I know our audience has learned a lot, and we've talked about so many different aspects of autism. Is there anything that we haven't talked about that you think is really important for our audience to know?
You're right. We've covered a ton, and I thank you for engaging me in this conversation. I think the only thing that we haven't talked about is strengths, and we really always want to take a kind of strengths-based approach. It's hard to talk only about the things that are challenging and the disabilities. We will always want to think about what are the great things about each individual kid, right? So these intense interests can be super fun and engaging. I think thinking about the way that people with autism can focus. I think some of our great minds, people have posited have been autistic, and so they've contributed hugely to science, to medicine. So always thinking about the strengths, and not having the disorder or the disability overshadow that.
I think that's really powerful. And I think, again, as sort of we talked about before, making the world more inclusive helps us all, really, right? Whether or not we have a diversity. But it's also the diversity that makes the world so great. And it's just so important to realize the strengths in every individual. And the fact that individuals with autism have unique strengths is just, it's just great.
True.
Now it's time for Doctor's Orders. This is the part of the show where our guest shares a single action that you as a parent can use to promote the health and wellness of your kids. What's your doctor's orders for us today?
I think I'd want parents to think about the importance of social developmental milestones. The doctors ask, when did your child first sit? When did your child first stand? When did your child first say words? people don't always talk about the social development. And so I think that's a really, really important one. And that can be one of the earliest signs of autism. And I think that may be one of the reasons we've missed some of the diagnoses along the way. And our age at diagnosis is a little older than maybe we want it to be. So just always be thinking about, when did your child first really laugh with you? When did your child first play baby games? When did your child first smile back at you? Those are super important, just as important as when did they first sit up by themselves.
Yes. I love that. So parents can sort of have that, that knowledge to say, I need to look at my child's development, both physical, motor, and just general development milestones that we already all are so attuned to and looking for as physicians and as parents. But then this other very critical piece, which is the social development. And so I think that's really powerful advice for all of us.
Great.
Thank you so much for chatting today. It's been so fun.
Thanks for having me. I've really enjoyed it.
Thank you for tuning in to this episode of Boston Children's Answers Parentcast. And special thanks to our guest parent Meg and our expert guest Dr. Sarah Spence for her valuable insights. Don't miss out on future episodes. Subscribe now to stay updated. For additional details, visit bostonchildrens.org. Until next time, take care.